Hello all, I'm Dr. Divya Jose. I'm a senior consultant gynecologist at Lourdes Hospital and Divine Rose Women's Clinic, Kochi. Most of the women I know have sleepless nights when they are nearing term because they are worried about how the delivery will happen, whether they will be able to tolerate the labor pain. So they will be worried about what to do to make the labor pain more tolerable. Are there any techniques which can help them to make the labor pain more bearable? Most of the women may not need these because they are okay with the pain. They'll be able to tolerate the pain. But some women will have sleepless nights and maybe even consider cesarean section because they don't want to go through the labor pain. So what are the simple techniques or which don't involve any medication used to help to relieve the labor pain? One of them is the breathing exercises. So when you go for your antenatal classes along with your partner, they will tell you about how to do the breathing exercises so that it helps in relieving the pain. But you have to learn it in the antenatal period because when the pain starts, to learn a new technique and time it accordingly will be very difficult. So during that antenatal classes, learn the breathing techniques, breathing in and breathing out, the techniques which can help you in relieving or concentrating more on your breathing rather than on your pain. Then some massage can help you. The pain usually starts in the lower back area. So if somebody can massage you in those particular points, then definitely it can help in relieving the pain or making the pain more bearable. Then there are techniques in physiotherapy, in acupuncture, where they play, which is called TENS. Like they place small electrodes in your lower back and send small current signals when you're having the contraction so that it modifies the pain, it modifies the nerve signals in a way and makes the pain more bearable. So all these techniques don't have any particular side effects, but they are not very efficient in relieving pain. So if you feel that the pain is much more difficult to bear, we can think of much more higher techniques. Like the first would be a gas inhalation called the Entonox, which is a mixture of both oxygen and nitrous oxide. And the patient is asked to inhale through a mask when the contraction starts until it passes off. So it's a very short-acting gas which you're inhaling, and for that period of time it gives you a relief. But you may feel slightly giddy or drowsy, and you may feel slightly sick when you're taking the gas inhalation. Not very often, but sometimes it can cause some giddiness and some sick feeling. So, but it can relieve the pain to some extent and doesn't have any much effect on the baby also. If you're not okay with the gas, again, there are injections available, which are opioid injections, which can change the way how you feel the pain and also make you feel a little drowsy so that in between the contractions you can get some rest. But not all patients can be given injections, and we cannot keep on repeating the injections because the dose goes to the baby also. So we might have some restriction on the amount of medicines we can give. And when you're closer to delivery, when there's not much time between this onset of pain and the delivery or when the baby comes out, we may not be able to give you an injection because the baby won't have enough time to clear off the medicines from their body, which can cause problems with their breathing. So we're very close to labor, we may not give injections. Then the most efficient method of pain relief is an epidural analgesia. That is what is equivalent to the painless labor. So when a proper epidural or when the epidural is fully in place, then you won't have any pain during your contractions, or at least some 80 to 85% pain relief you can get with a epidural analgesia. So what happens during an epidural analgesia is a small hair fiber thin cannula or a catheter is placed in the epidural space, which is a space in your backbone. So through the backbone, they will give you a small injection, and the catheter is placed inside the epidural space, and analgesics, that is painkillers, are given through this injection, through this catheter, so that you won't feel the pain, but you'll be able to move your legs, you'll be able to push, you'll be able to see what is happening without any discomfort of the contractions. You'll be able to feel the contractions, but you won't be appreciating the pain. So if you're planning for an epidural, because this is put in by a trained anesthetist, so definitely you'll have a consultation with an anesthetist in your antenatal period itself. You can discuss the pros and cons of having an epidural and then decide whether this is the best method for your pain relief. So once you're okay with that, when you are in active labor, the anesthetist will come and put the catheter, and then it will be kept till you deliver. So during the process of delivery also it is going to go on, so that when we are stitching, if an episiotomy is required, when we are stitching the episiotomy, it can help in relieving the pain then also. So are there any side effects with the epidural? So the epidural can sometimes cause headache. Epidural may not be completely effective for some people. It may not work properly for some people. Then at that site of injection you may have some little pain for a few days. Some people may have difficulty in walking around and passing urine immediately after the epidural is removed, but it recovers with time. There's no permanent damage with epidural. And some people may find that their second stage, that is when the delivery period, may little be longer than the people without epidural, and sometimes they may require assistance in delivering the baby, like a vacuum or a forceps. But there's no increased risk of cesarean section with an epidural analgesia. So you should know about some technique which can help you bear through this difficult labor pain, so that it doesn't become a very horrifying experience for you. You should have a memorable experience of giving birth to your baby. So you should understand which are the techniques which can help you decrease the pain. Thank you.